Welcome to the Envisioning the Future of Disability Policy in Canada webinar. This is the 14th webinar in our Return to Work, Stay at Work series, and we're glad you're here today. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar is made possible through the support of the Direct Access Program through the BC government. As I mentioned, my name is Tanya, and I'm moderating the session today as well as doing the question and answer. And our presenters today are Drs. Emile Tompa and MacEachen. Emile Tompa is a labor and health economist and a scientist at the Institute for Work and Health. He is co-director of the newly established Center for Research on Work Disability Policy. His current research examines the consequences of occupational health and safety, system design features, and other labor market policies and programs for the health of individuals and populations. MacEachen studies the sociology of work, health, and disability management. She is co-director of the newly established Center for Research on Work Disability Policy. She is a scientist at the Institute for Work and Health as well, and is an associate professor in the Dalla Lana School of Public Health at the University of Toronto. Her research examines how systems for work, injury prevention, and disability management are considered in law and policy, conceptualized by decision makers, and implemented into practice. All right, I'll go ahead and hand it over to you, Emile and Ellen.
Okay, thank you, Tanya. Okay, so I thought I may just start off by saying that the name of this presentation comes from a SSHRC grant that we were awarded for a partnership that we've set up since being awarded the grant, and we've changed the name to the Center for Research on Work Disability Policy. And it's a research center, as the name describes, on work disability policy, and we're taking a population health approach to the work that we're doing within this initiative. So our framing is that illness and disability touches all people at some point in their lives. So our objective is to improve Canadian work disability policy to have all people access employment. Just to give a bit of context of the initiative, it started off with our realization that the Canadian work disability policy system is quite fragmented. We have, I think, 7 or 8 different programs at the provincial and federal level, and they all have different kinds of eligibility requirements, and there's not really much cross-program coordination. And that, coupled with the fact that the nature of work is changing, workers and relationships with their employers are changing, and the nature of injuries are changing as well. So that creates a lot of challenges for the current context of the patchwork quilt of programs that we have currently in existence in the Canadian disability policy system. As well, we found that the different disability communities are operating separately. The injured worker community has its own advocacy movement, and people with disabilities in the other communities as well are working independently. And also the academics, we found, were working in silos. Myself and Ellen, we do a lot of work in the workers' compensation field. There's a number of academics who work more on the social safety net programs outside of workers' compensation, such as, Canada Pension Plan, disability and social assistance, and a number of other social safety net programs. So we found that the academics were working in silos as well. Additionally, we found that the policymakers have very little cross-program coordination and discussion around how people access the various programs that exist in the Canadian disability policy system.
Okay. Ellen MacEachen speaking. Emile and I will be going back and forth between us throughout the presentation. So the next slide that you see here refers to our population health focus that Emile already mentioned. It's important to us that our initiative be understood to be relevant to everyone in Canada. We're not focusing on a small fringe population. We're considering work disability as touching most people at some point over their lifetime. And if we think about labor force productivity in Canada, it's really contingent on all people who can and want to work being able to access work in Canada. We don't want to have systems that keep people out of the labor force when they can and do want to work, and we do have some sort of perverse outcomes of systems that create that situation. So basically, we want to address the challenge of our fragmented work disability system that was developed in another time. Life changes and workplaces change, the nature of health problems change, and we need to focus on the current context. So, as Emile described earlier, there are divides between programs. Disability benefits and labor market supports can cut across multiple levels, but people from the various systems rarely interact with each other. So for instance, in our own research focusing on work injury, we would see injured workers who had bounced from the workers' compensation system onto other systems. And yet the people who study those other systems rarely understand the context of workers' compensation and vice versa. In Canada, we have quite a complex environment in Canada with at least 7 different disability support programs, and Emile will be describing and talking about those in just a couple of minutes. We also have programs that span both public and private domains, and some programs like workers' compensation are in some cases mandatory and in other cases non-obligatory. So for instance, in Ontario, where we're based, about 70% of workplaces are required to be covered by compensation, but others can opt in if they wish. So those are the non-obligatory. Systems also make distinctions between work and non-work related injuries and illnesses, and with different support provisions depending on the cause. And of course that can be extremely complex when you have slow developing problems, and it's difficult to pinpoint whether it started at work or not. So we want to bridge these program divides with our initiative to try to look at some of the core issues that affect real people as they bounce around between these programs. Bridging the stakeholder divide is also a challenge for our initiative, and something that we really think is important to tackle. We've talked about, mentioned different types of programs like workers' compensation and perhaps social assistance, but we also see employers as active players. They're not just purchasers of services. They're the people who make work accommodation happen in workplaces, and so we see employers as a very important part of our initiative. Injured worker communities have worked separately from other disability groups, and yet both groups face many of the same problems related to permanent employment and access to permanent disability, rather, and access to work. And academic researchers, for instance, tend to find themselves either in an occupational health domain or in a disability research domain and rarely interact. And we have so much in common, actually, and so much that we can build on if we come together.
Okay, so I'm just going to give a big overview of the Canadian Work Disability Policy System. And on this slide, I have listed 7 different programs that exist, and there's others as well. Like, I don't have car insurance on there as well, which has a disability component to it as well. So one of the key ones that most people are aware of is the Canada Pension Plan Disability. There's a counterpart for Quebec, the Quebec the Pension Plan Program. It has a disability component as well. Employment insurance, the EI program, has a sickness benefit for short-term sicknesses. Veterans benefits have disability components to it as well. There's credit systems for our federal and provincial taxes that allow for deductions and credit for disability expenses. The Workers' Compensation Program is a provincial level jurisdiction that exists in all of the provinces and the 3 territories. There's also social assistance that has a disability component. In some jurisdictions it's separate from the general social assistance, in others it's together with the 2 parts. And then there's employment-based long-term disability plans that are often private sector. And I also want to emphasize, as Ellen did, that we include employers in the disability policy system as well. So this picture here we have is strictly about the program offerings from different providers. some of you may know that some programs are cause-based, and so that's a key delineation across some programs. There's other eligibility requirements that differ across programs as well, but one of the key ones that people may be conscious of is the cause-based. So if it's a work injury or illness that's associated with exposures from work, it would normally be workers' compensation that would cover benefits and health care expenses associated with that health condition. But certain types of injuries and illnesses are not covered, even if they might be perceived to be work-related. A key one would be mental health, which is generally not covered by workers' compensation. For the non-work caused injuries and illnesses, say it happens outside of work or it's a congenital condition, there's other types of programs available. Employment insurance, as I mentioned, offers a short-term sickness benefit program for people who have contributed to the program. So you have to be working and contributing to EI to be eligible for that. Some employers and individuals might choose to purchase private disability insurance, and so that's at the discretion of the employer or the individual. About 55% of workers in Canada are covered by such benefits. I've mentioned also the Canada Pension Plan and Quebec Pension Plan. These are public pension plan programs that require an individual to be wholly or substantially disabled, so it's an all or nothing. It doesn't have a partial disability component to it like workers' compensation. Again, you have to contribute to it to be eligible for it. And then the last one I have is also on this list is social assistance, which is available to anyone, but it's means tested, so you can't really have any substantial income or savings in order to qualify for this means tested program. And in this next slide, I just want to give a little bit of an example about how sometimes the exact same condition happening or injury or illness happening in the exact same situation or context can result in very different benefits provisions depending on your labor market contract. So this example I have here on the slide is someone who has a car accident as part of their work and becomes permanently disabled from that car accident. And the kinds of benefits and supports that would be provided to that individual would vary quite dramatically depending on whether they were self-employed, whether they were an employee working in a sector that's covered by workers' compensation, or whether they're an employee that's in a sector that's not covered by workers' compensation. So for example, a self-employed worker, they probably wouldn't have purchased workers' compensation insurance. They do have that option, but it doesn't usually get taken up by self-employed individuals. They might have purchased private insurance, but they may not have taken up that option either. If neither of them are eligible, neither of those programs have been purchased by the individual, they could also default to getting benefits from the Canada Pension Plan Disability if they're wholly or substantially disabled. If they don't qualify for that, they might actually get social assistance for people with disabilities, and that's, as I mentioned, a means-tested program. If you're an employee and you're covered by if you're in a non-covered sector in terms of not covered by workers' compensation, you would maybe have a private insurance program that you'd qualify for if your employer had purchased that. If they hadn't, then you would obviously qualify for the Canada Pension Plan because you are working and contributing to that program. Or as a last resort, there's also social assistance. Now, if you're in a workers' compensation covered sector, you would be eligible for the workers' compensation in that instance, which offers partial or full disability coverage and covers all the health care expenses and rehab and as well as physical and vocational rehab services. And as well, you might qualify for Canada Pension Plan if you're wholly or substantially disabled. So as you see, across those three different examples, the coverage that a person would receive is quite dramatically different. In some cases, it's means tested, below poverty level benefits under social assistance, or it could be very generous programs such as workers' compensation, which covers in Ontario 85% of after-tax earnings up to a certain cap.
Okay, so you can see, what we're trying to do is to provide a sketch of the complexity of this field. And as we're describing these issues, if you could just imagine being a worker or someone who wants to work and trying to navigate these systems, it can be really complex. A challenge is that there are different paradigms that guide different models, and it's really that explicit. You have to sort of read between the lines sometimes to unveil these models. Many programs are based on a medical model, and so the focus is on individuals and medical assessments that focus on biological structure and function. So for instance, Canada Pension Plan Disability, some workers' compensation authorities and social assistance often use that model. Another model is socio-medical. So looking at the individual once again, but bringing in a little bit of context. So the health condition is necessary but not sufficient. Focusing as well on things like physical and social environment. So for instance, in workers' compensation systems that focus on things like wage replacement, the socio-medical model helps determine assessments of loss of earnings capacity. And some private insurance uses as well. A third key model that's around is a human rights model. And this is focused not on the individual and some kind of deficit or challenge, but focusing on society and how is society organized and structured to provide human rights and access to everyone with any kind of shape or size or ability. And so an example of this is the United Nations Convention was ratified by Canada. Across these paradigms, you're going to get socio-political challenges. And this explains actually why, in the past, groups haven't worked together. Why, for instance, injured worker groups haven't necessarily teamed up with disability advocacy groups. Workers' compensation, for instance, is often seen as a legal right based on a historic compromise where workers gave up their rights to sue employers in exchange for no-fault guaranteed support. Through workers' compensation, workers can access things like wage replacement up to a certain percentage, medical and vocational supports. In contrast, people with disabilities or injuries or illnesses not incurred in the course of work or determined to have incurred in that way, face different systems. And so a contrast to the human rights, the workers' compensation approach is the human rights code, which is basically duty to accommodate, focuses on claims of discrimination, reviewed on a case-by-case basis. And so this is relevant for employed individuals and also for in terms of hiring for certain strata of the labor market, federal employees and their contractors. So other socio-political challenges, there is no end to them, are the different types of systems that exist. You can get market-based insurance systems, public disability pension programs, and then the state as a provider of last resort. And so the market-based programs are based on workers and employers voluntarily purchasing insurance. Public disability pension programs are often compulsory and administered by the government because, EI. And then finally programs where the state is a provider of last resort. And as Emile was mentioning, for those who see means testing and, and in these programs you get clawbacks of earnings from other sources. Pretty challenging situation.
So Alan's done a great job of describing that complexity of a system that we're calling the work disability policy system. So now we're just going to bring you back to our Center for Research on Work Disability Policy, which, as I mentioned, was recently funded by SSHRC for a period of 7 years. What we are is a transdisciplinary initiative. We're taking multiple lenses on this issue, and we're trying to think about what the future of work disability policy in Canada should be. What is our vision of that future? We're trying to bring together the various stakeholders in the disability policy system so that we can think as a group what is the way forward, to try to build a roadmap for that way forward collectively. So we're trying to bring together all of the stakeholders who are involved, both the communities, the program partners, the employers who are part of the system. We're trying to identify the problems and the challenges associated with the nature of our system that we have today that's not coordinated and it's complex. How can we do a better job of coordination and addressing that complexity? The process obviously will involve some dialogue, problem identification, and then think about what are the policy actions for the future. Within the center, we're trying to undertake multiple transdisciplinary research projects. It's going to include also some international comparative work. So there's a battery of activities happening on the research front, as well as doing some capacity building for research. And we're having a number of students involved throughout the 7 years. We've put aside quite a bit of funding to support PhDs and postdoctoral fellows within the initiative so that they can enter into this field and do their research in this area. As I mentioned, we're trying to build consensus on the way forward. We describe that as a roadmap for work disability policy change. We're working together across Canada. It's quite a large initiative in terms of the number of participants and partners involved. We have 51 academics from across the country, including myself and Alan, and a number of co-investigators and collaborators coming from a variety of different disciplinary lenses. We have 46 partner organizations, and they include community organizations, so a number of work disability organizations, universities, insurers, as well as service providers. In fact, we have 15 research institutions involved in the initiative across Canada. There's 4 clusters. There's a cluster in British Columbia, one in Ontario, a Quebec cluster, and another cluster in Newfoundland. We were recently awarded from SSHRC $2.76 million. That's a 7-year initiative, so it'll take us through till about 2020. We also have a number of partners providing matching funds in kind and cash funds to the tune of about $3 million. So collectively, then we're operating within a fund of about over $5 million that'll help us undertake the variety of activities that we're planning to do over the course of the next 7 years.
Okay, so we have devised a number of research questions and themes to guide our efforts with this new center that is just starting up. So the main focus of our center is to identify how people, when disabled, can be better retained and integrated in the Canadian labour market. 3 of the key research questions are: how well does our Canadian disability policy system serve the current and emerging needs of working-age individuals when disabled in terms of employment support and opportunities? For what individuals and what labour market context does it work well or not well, and why? And what are some of the key opportunities for policy and program improvement in the long run and in the short run? Certainly, when we interacted with some of the people, they were saying, well, you have funding for 7 years. We can't wait 7 years for answers, and we have no intention of that. We'll be producing research findings all the way through in the short run as well. We have 3 core research themes: population analysis, labor market analysis, and law, policy, and program analyses. So the population analysis is basically looking at population characteristics. Who are the work disabled? What is the condition of these people? The labor market analysis is looking at job conditions, labor market conditions, skill development issues, and the role of employers. The law, policy, and program analyses will be investigations at the provincial and federal level, as well as international, to understand how programs work, including across program barriers to accessing support. We'll be engaging in comparative analyses of legislation across provinces and looking to other jurisdictions to see how they do things too.
Okay, so just a little bit of advice. I'm not sure if it's relevant for activities you guys are doing in the audience. Building our partnership. So one of the things we realized when we were undertaking the gathering of all the people and ideas to build the partnership, that we really did it at a right moment because there was a number of reviews happening at the federal and provincial level. You know, an EI review here in Ontario. They were doing a review of our social assistance program. Our workers' compensation board here in Ontario was also reviewing their programs. So it seemed like the right time to think about how we can look at all of these different programs collectively and better understand how they work or don't work together. And so we felt it was a great time to seize that moment when we are thinking as a country about how our programs are working and how we can do a better job of providing support for people when disabled. We built the team one person at a time. We had individual conversations with a lot of the partner representatives and the academics over the phone. You know, when people were across Canada, so we were setting up meetings with them and telling them about what we want to do, getting their thoughts on what the issues were. And it happened one person at a time. You know, so the 51 academics and 46 partner organizations, as you can imagine, took a good year and a half to have all those conversations before we really had an idea of how we were going to work together. One of the things we found too is we decided not to be afraid to approach people we didn't know very well. Some of them were senior academics, and we have I think about 6 Canada research chairs involved in this initiative, and some of them we know personally, others we didn't. But we this is an important idea, important issue to address in Canada, so we just go forward and we talk to them, and they were really excited about it. So we're really pleased to get them on board. A lot of it worked through a sort of what we described as a snowball method. We asked people, who do you think we should talk to about this issue? What other community partners should we get involved? What other academics have been doing work in this area? And it grew through, a small snowball that got bigger and bigger. We also offered different levels of engagement, particularly for some of the program partners who were apprehensive to participate. So we didn't expect them to sign on as an official partner in some cases, but they came to meetings to get a sense about what we're all about and what we had to offer. We particularly found, say, with private insurers that they were apprehensive to really come on board as full-fledged partners. So they had sort of an observer status at some of our meetings. So we allow people to kind of get test the water to get a feel for whether it's working for them. The community partners were our most valuable resource. They were the most active players right from the beginning, and they really helped develop the program and also are playing a key role in our governance, which I'll talk a little bit about later. We also hired an arm's length sort of facilitator to help with some of these meetings where we had big gatherings of people coming from all parts of the system, different stakeholders, a number of different academics from various disciplinary backgrounds. It really helped place the emphasis, some of the team meetings we were holding across the country, to place emphasis on brainstorming rather than the different personalities and the different vested interests that people brought to the table.
So on to momentum. Emile began this discussion by talking about how we were working to seize the moment. And certainly people have said to us, people have focused on work disability policy before. What's new about your initiative? And really it does seem to be a matter of timing. People have tried to do this before. One thing that is novel about our approach is that we are bringing together 2 different communities, the workers' comp and the disability communities. And so when people have worked on work disability policy, it's often been, for instance, in one community, such as everything except the workers' compensation community. But we have found that people are increasingly interested in working in partnerships. Emile and I have just come away from Akira that Emile was the academic co-lead of, that involved several years of working academics and injured worker groups working together. People are increasingly interested, perhaps because it's a globalized world, a global economy now. People are interested in multi-country initiatives and how things are done elsewhere. And so, for instance, we're both part of a CIHR training program in work disability prevention that started off as a Canadian training program that has become completely international in terms of students and governance, because that has been such a stimulating way to think about system improvement. Also, government-academic partnerships. are becoming more and more viable. For instance, recently we have had government departments approach us and say, oh, we'd like to learn more about your center. We think that if we talk to each other, we would both benefit. And so the timing seems right. Certainly the business of social support programs and the business of workers' compensation is increasingly overlapping. They're starting to look at each other more and more. Workers' compensation is set up to recognize acute injuries, clear-cut problems that happen at work. But really what's happening is more and more problems are slow developing and chronic, and it's very difficult to pinpoint it starting at work. These workers often end up bouncing to other systems. Meanwhile, social support is saying, oh, we don't really understand how return to work functions, and we'd like to get into that business. And that, of course, is the business of workers' compensation. So the timing is right to bring communities together because they're starting to look at each other anyway. We do anticipate some challenges. We are bringing together diverse communities, people who haven't necessarily spent much time talking to each other. And so we recognize that we need to maintain the engagement of participants and partners, understand the diversity of stakeholders and geographic dispersion. So for instance, our Quebec group, researchers don't always have an interest in focusing on federal level issues, but and have their own systems, and that's really important to understand and to respect. And we're actually very proud that of our 4 provincial clusters, Quebec is one of them. If you look at, for instance, OECD reviews and other reviews, Quebec gets excluded, and so we've spent quite an effort to make our initiative as bilingual as possible, and so on and so forth. So we've been trying to straddle language and cultural identities and try to get diverse groups involved, including employers, workers' compensation, and private insurers, although these probably are our greatest challenge, but we do anticipate being able to get them involved.
Okay, so as Alan pointed out, we've structured the initiative to try to get everybody to work together, across various divides or boundaries, both geographically, some disciplinary, programmatically, different disability communities, trying to get them all working together within this initiative. It's a partnership grant, so the academics are meant to partner with the participants from the different communities and programs as part of their research process. So we try to integrate the partners in the research and also in the governance. So we have representation from some of the disability communities in various aspects of the governance of the initiative. It's meant to be multi or transdisciplinary, so we're encouraging all of the academics to also include their academic peers from different disciplines in their research as well. So all of the research studies, and we're doing a number of small and some large projects as well within the umbrella of the center, are meant to include partners in various aspects of the research process. As I mentioned, we're trying to bridge disciplinary divides as well. So to help facilitate that, the provincial co-leads in each of the 4 clusters are coming from different disciplinary backgrounds. We've tried to get someone in each of the clusters to be coming from the workers' compensation, occupational health and safety side, and someone coming from the political policy, disability policy, and disability theory side to come together to co-lead each of those clusters. We're also trying to build a model for students, and the students obviously are part of our capacity building process, where they realize the need to transcend silos so that we're open in new ways to understanding the challenges of our complex disability policy system. In terms of knowledge mobilization, we have quite a layered knowledge mobilization plan. I'm just going to give you some of the highlights. We have, as I mentioned, partner involvement in the governance, in various governance committees and activities. One of the highlights is a champions group that are supposed to be representing the initiative, people who are well known in the public face and public media, people such as Mike Bradley or David Olney, who we hope will be spearheading the initiative's mandate and objectives and activities. So they'll be highlighting the work that we do. We'll be also supporting internships for both students to work in the community to get a better sense by being right there in the field of what the issues are in the disability community. They'll be building capacity by doing their research in this area, either PhD theses or course papers or some postdoctoral fellows as well. And hopefully through the whole process we'll also be creating public awareness about the issue of work disability and the fact that it touches all people at some point in their lives. Some of the events and activities that we'll host to bring stakeholders together include having policy round tables, community forums. We're also planning to have 3 national symposia, one at the beginning of the initiative, which will hopefully happen sometime next year, one midway and one towards the end of the initiative, as well as holding international workshops and a disability policy conference at some point over the course of the 7 years. Trying to take advantage also of various dissemination channels. One of the highlights is a website that should be up later this week. It's a multi-layered website. We're developing an e-newsletter that will be out quarterly. We'll host some webinars ourselves through our site as well. We're also putting together some video stories of stakeholder experiences. So injured workers, their lived experiences, they'll be telling us their stories on video so that we get a better sense of what it is like to fall through the cracks of the disability policy system. In terms of our research, we'll prepare some one-page research highlights so that's available for more popular consumption rather than having to always go to the academic journals to get some of the research. We will be preparing them in packages that are accessible to a broader audience. And we'll be packaging all of these things together, hopefully being available through our website, which will have multiple layers to it. I'm not sure. Do you have anything else to add, Alan?
No, I think that's it. I think it would be great to hear some questions from people and engage in discussion points.
Sure. Thank you very much for that presentation. Let's see. One question we have is, as a result of the current patchwork of policies, would you say that disabled people are not very well integrated in the labor market, and what specific issues do they face?
One of the things that we're seeing is people going in circles because of the patchwork of policies. So, for instance, we meet people at the legal clinics who are trying to support people, and they'll have an example is someone who was injured at work and they can't quite get back to work yet, but there's some determination that they shouldn't be as impaired as they seem to be, and so they should be back at work, but they can't. So they end up losing their job, and they can't go back to work, and you have a cycle of appeals then. And then you have a tribunal at the end, and that can take years. And then at the legal clinics, they talk about helping people to prepare, trying to access other systems, and then each system will have a different definition of disability and different requirements from medical providers, and pages and pages and pages of forms that healthcare providers really hate dealing with. And so these are some of the challenges. And so someone who maybe had a problem that wasn't that complicated can find themselves in some sort of spiraling process that leads them down a path that isn't back to work because they had the right supports at the right time. It can end up being years of problems. And so that is certainly one of the things that we'd like to tackle.
Yes, yeah, and we've interacted with a lot of people from the injured worker community who've had these experiences where they've run through various programs, the administrative bureaucracy and the difficulty of getting the supports that they need, so that more of their time is consumed with, filing for claims, searching for support, trying to understand what is required to access different programs, getting supports from various legal clinics, and so their time's consumed with that rather than getting back to work.
Or some programs, some people can work, say, part-time, right? Maybe not full-time, and yet they risk losing their program supports if they do work part-time, or if they might work part-time, but there's no financial benefit because it'll be clawed back. And then you're thinking, well, you know, I actually have to, for this job, I need to go out and I need to buy some new clothes, I need to buy the bus tickets, I need to get to work every day. The money will help me to work, and I will gain this experience by working that can help me moving forward. But then you have program rules that either provide no incentive to work or a disincentive to work. And I don't think that was how anyone ever really intended programs to work either.
Very good. We have another one. What can employers do to help disabled people integrate into the workplace?
Yeah, sure. So as we mentioned, employers are a critical player in the disability policy system, and they play a key role. They need to play a very active role, and oftentimes they're not aware of the kinds of things they can do to accommodate workers. And I've heard some experiences say that it's sometimes not that onerous, and they don't even realize, you know, that if you just allow a little bit of flexibility time-wise to get to work, or you make some accommodations on the workstation that don't necessarily need to be that expensive, that it can actually work quite well. There's also the role of the co-workers that they need to be familiar with the kinds of accommodations and that are needed, so that everybody is, you know, pitching in to make sure that it works for everybody involved. So, you know, there's an important role for the employer and the work site to play in accommodation.
Yeah, sometimes employers think about, well, what will it cost me to make these changes? But a lot of what employers can do is helping out with the social environment, creating an atmosphere that allows different kinds of people to work, and also encouraging an accepting environment within the workplace. So there's a lot that employers can do.
Yeah. And sometimes, a lot of times actually, it's a win-win situation where once you realize the accommodations aren't that onerous, that there's actually a lot of talented people out there that we haven't been accessing and giving opportunities to integrate into the labor market, that they can offer a lot to the productivity of organizations. And it's actually a lost opportunity if they don't really act proactively in the process of making sure that everybody has that opportunity to take up the kinds of challenges that they can take up.
I just want to add a note to it. It made me think of something. A challenge that we have is a lot of our programs to help people integrate into the labor force or reintegrate are based on training the individual to have more skills. And of course that's important, but also just having a job and working is important. And so a focus on the employer role is critical. And, you know, I've done a lot of research on different topics, and I remember one employer who said that they had taken a worker because it was very much at a reduced rate for the employer because it was a placement, a trial placement, and so the employer took a risk on the worker because it wasn't going to cost them very much. And then realized that, you know, geez, everything is fine and it's working out really well, and hired them on permanently. And so we may need programs not just to train workers, but to encourage employers to take a chance on people and then actually hire them too.
All right. Another one is, since healthcare-related injuries are highest in Canada and in BC, how much research is being done, if any, on the process for those injuries?
Sorry, is that about the healthcare sector and work-related injuries in the healthcare sector?
The question's not fully clear to me. I think they're more talking about healthcare. Well, it says healthcare-related injuries. He said, sorry, the person did respond, yes, it is about the healthcare sector.
Well, good. Well, sorry, that's a really important sector to think about, particularly because, you know, the aging of the population, and in the healthcare sector, I'm told that the average age of the frontline workers and the nurses is about 48 years old, so really critical to think about how health over the life portion, as the population is aging, how we can continue to accommodate, you know, those workers so that they can stay in the labor market. And actually, someone in our initiative, by the name of Heather Scott Marshall, just put in a grant to do work on this topic, to look at frontline healthcare workers, to understand how the work environment can be accommodating for their needs as they age.
That's a good question, because we have a lot of, the way that we are set up is to provide people with seeds and incentives to engage in this research. So we haven't got a pre-structured plan of all the different studies. But we do have, we mentioned that we have 4 provincial clusters. We do have themes across the country and people meeting together to focus on priority topics. And so, you know, there are various different topics coming up, and we'll have quite an array of research foci by the end.
Wonderful. That's all the questions. Oh, wait. I just got another one. Let's see. Someone's asking, should thought be given to training coworkers regarding the disability and their attitude towards it once they understand what the disability is and what that person endures, since some disabilities are hidden?
Definitely, and it's more than just training. Training coworkers is very important, but there's emerged more and more research coming out now on the role of coworkers, and what happens is sometimes people get placed in a department, and then the supervisor or the manager walks away and assumes that everything's going to be fine, and some of us conducting this research have been arguing that supports need to be given to coworkers too. You can't ask someone to do their job and to do so much else on top of it without doing something to perhaps lighten the load, or at least to acknowledge that extra effort. Because right now, the way coworkers describe what it feels like to be a coworker in these situations is they feel that their effort is quite invisible and unacknowledged often. So there's a lot that needs to be done to training coworkers about these invisible health problems, and how someone who looks like they're okay and seems like they can do everything isn't always able to. But also in workplaces, you have to structure the environment to create an enabling environment for this to happen.
Yes, and I guess that would be the normal. Like, everybody realizes the need to play a role in the process. So it's not only about the person and their disability and the employer, but all of the co-workers as well. So it's creating a new normal of, you know, integration and accommodation and acceptance of diversity.
Yeah.
All right, and then another question, wondering if your research is going to include research about innovative supports that people with disabilities have found or use for themselves already, i.e. meditation, stress reduction, or are you guys more focused on policy?
Well, that's a really good question. We're definitely focused on work disability policy, but we're also looking at innovative supports. One of our students that we're supporting now is focusing on how people with chronic pain conditions manage to stay at work despite these pain conditions. And so this is very much focusing on not necessarily the broader policy structure, but what's going on for those people and their interactions, but always against a backdrop of the policy structure.
Yeah, how the policy arena can help facilitate some of these things, you know, whether it's, you know, some program that provides mentorship and support, you know, behind the scenes on an ongoing basis in some cases where some people may need support on an ongoing basis, whether it's just, you know, coaching of support, or whether it's actually some kind of services, some other services. But certainly that's all integrated into the policy if the policy is trying to provide the kinds of things that people need to be able to integrate into the labor market.
Yeah, and for instance, some of the policies often focus very strongly on functional ability, which is a very limited way to understand these problems. There are so many other social issues going on, and alternative ways of managing conditions, and, you know, such as was just mentioned in the question, you know, meditation and different types of support. So it's possible to study these things and then to refer back to our policies and to think about how they might be improved.
The person who asked that question said thank you because they find that policy often disallows or undermines the preventative or maintenance of those types of things to encourage people to work.
Yeah, it's
good point.
It's true. I mean, policy can be reactive, right? And we need to set up structures that stop exclusion from happening in the first place.
Very good. And then another question, are you finding collaboration at all levels is open to discussion and ideas, especially from government institutions, for example, provincial health authorities?
We are getting a lot of interest from various government officials, including at the federal level and HRSDC. All the partners have some great ideas to bring to the table, and we're actually thinking of having on our website hot topics for, each of the partners may have some ideas of what they think are the priority areas to focus on in terms of research-wise. Hopefully that'll be a forum where then the academics and the students can come to take up some of those challenges and do some research on those topics. So we are really looking to the communities and the partners to come forward with their ideas about what they see as the pressing issues.
Yeah, it's been an interesting development to us that as we started, it was sometimes hard to get people's attention, and now when people see the center that we've created and the wonderful talent from across the country, the real strength of the academics, yeah, they're coming to us and saying, oh, what are you guys doing, and how can we be involved?
Mm-hmm. Yeah, it has enough critical mass now, I think, that they realize the value of working together to resolve some of these issues.
Very good. At this point, we don't have any more questions. I might give it just one more second in case anybody else has a lingering question, since we still have a little more time. I was curious, somebody did ask whether you're approaching colleges and universities along the previous question with, openness from government institutions, etc. Now, I know a lot of your researchers who are involved are probably connected to universities, but are you also pursuing colleges and universities on more of an administrative level around their own policies for it?
And that's a good question. One of our partners who focuses on mental health challenges, their focus and their interest is very much the people with disabilities at universities and colleges and how they can be integrated. And for them, it's around mental health challenges and problems. And I think that topic has been in the media quite a bit recently. Actually, mental health of young people at universities, and so we do have people involved in that. Another one of our researchers is looking at high school training programs for people with learning disabilities and how they can help workers these students to get out of high school successfully and to be integrated in the labor market. So we have some people tackling it from different directions. It's a good question, interesting point.
And then we did have another question. What's the first step towards establishing a uniform disability policy?
And that's for you.
Oh gosh. I'm not sure that we necessarily think of this as bringing all of the programs together into one universal program. I mean, there has been some discussion by certain groups about that issue, and certainly there are examples in Europe, particularly Northern Europe, where they have a more comprehensive universal disability system that isn't cause-based, so whether you get hurt at work or injured or ill outside of work, everybody can access that program. So that is a possible model, but that is not necessarily what we're seeing as the roadmap to the future. We really are exploring different options, but I really think at the front end, some of it is more about coordination. The systems we have in place have a long history, and have evolved to a certain point where they are at today that maybe makes it more challenging for people who need to support over different parts of their life course. But certainly the coordination part would be the first thing that we think of addressing, and then thinking about that short-term gains to make the system work better for people. What's the mid-range gains and what that long-term vision is something that will evolve through the work that we do collaboratively. So it's not like we have the answer for that long-run vision today.
I think it'll also depend on the political environment now, and in 7 years' time, and in 3 years' time, and what people have an appetite for. Will people want to be a little more conservative and just say, let's just, we think we can tinker with our current system a bit more, or will there be an appetite for, broad refreshing of how we do things? So we very much have we have an approach to working hand in hand with partners and people to think these things through together.
Yeah, and we just try to be realistic about the precedent and the history that we have that's taken us to where we are at today, and what can be realistically achieved through the political process, the program development process, over the short, mid-range, and long term.
Yeah.
And then someone asked, what signs have you seen from the different systems that they want to be coordinated?
Well, that's a very good question, actually. One of the person who's actually leading our champions group, Alec Farquhar, has been very actively involved in these kinds of issues for a number of years, but has had some wins with, the different program providers in Ontario around workers' compensation and social assistance to get some dialogue going across those programs.
Yeah, a challenge with these programs is you get cost transfers, or what do we call it? Basically,
spillover.
Spillover, yeah. And so this motivates some people to think about change, and as they become responsible for their budgets, and then they see their numbers of their costs going up, and feel that there are spillover things going on.
And I think given the current economic climate where budgets are very tight for a lot of these program providers, they're realizing the need for working collaboratively, because any kind of tightening of their own program requirements ends up being spilled over into other programs inevitably, and if they're not working together, ultimately there'll be a lose-lose situation where neither are gaining, because they're just pushing off the client base to different programs, essentially.
One advantage of our center compared to perhaps other similar initiatives is that we are, I would say we're not interest group based. We don't have a dominant source of funding from one sector, such as the insurance industry. And so I would say that helps our credibility, that we have such a broad base of support across the country, a lot of academics involved. Our main source of funding is from the government, and we're independent researchers.
Yeah, it's a research funding agency.
Yeah. Yeah, research funding agency, that's right. We have to clarify that.
Very good. Okay, we're right at time, so I'm going to go ahead and close the questions now. Thank you very much, Emile and Ellen, for your presentation. That was really great.
Thank you, Tanya.
Thank you.
And I just want to thank everyone for joining us today.